Hi, Helen. Thanks for the question. It's a timely one. I think this is on the minds of many individuals. There are some examples of countries that have suggested that an individual may have been reinfected. There's still not, still not confirmed. What we need to be able to do is to look at a few things. One is the testing that's been done in an individual and how long that individual tests positive, because some people can have PCR positivity for many weeks, not just days, but many weeks. And it doesn't necessarily mean that they are infectious for that long. In fact, we know that they are not infectious for that long. There are some examples of individuals who have had, that have tested PCR positive and then after several days, several weeks, have tested, after testing negative, have tested positive again. We've had some examples in Korea, and that was not an example of reinfection. There's what we are trying to do in the instances where there may be an individual that tests positive again. We need to look at a few things. One is how the tests were collected, what samples were collected, the tests that were used to see if there are any issues of false positivity or false negativity. And what we ideally would like is to look at sequencing. If the virus can be isolated, if sequencing can be done, so we can look and see if somebody has been reinfected. The third thing that we're looking at is the immune response that an individual has after infection. You've heard us talk about this quite a lot. There's a lot that we're still learning. We expect that individuals who are infected with the SARS-CoV-2 virus develop an immune response. We don't know for how long that immune response lasts. We don't know how strong it is or for how long it lasts, and that is something that is currently actively under development. And of course, somebody will have protection from reinfection while they have those antibodies. So it's a long-winded answer to say we don't know yet, but we are actively following up any examples where this may be suggested.
Thanks very much, Dr. Van Kerkhove. The next question comes from Antonio Berto from the Spanish Newswire.